Hello everyone, thank you for joining me in today's critical discussion on the early signs and intervention strategies for anxiety disorders in children. My name is Dr. Nkendong. I am a psychiatric nurse practitioner. I also hold a doctorate degree in nursing practice. As some of you may know, mental health issues in children are a rising concern, requiring immediate attention for early intervention and effective management. Before I go any further, I would like to say this information is intended for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making any medication or lifestyle changes. According to a study published in the Journal of Clinical Child and Adolescent Psychology, about 7% of children aged between 3 and 17 are diagnosed with anxiety disorders. This speaks volumes about the urgency of the matter at hand. Today, we will delve deeply into recognizing the often subtle signs of anxiety in children and explore evidence-based strategies to address them effectively. So what is childhood anxiety? Anxiety in children isn't merely an adult issue scaled down to a younger age group. It has unique characteristics and manifestations that are distinct from adult anxiety disorders. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, childhood anxiety disorders can range from generalized anxiety disorder and social anxiety disorder to specific phobias and panic disorder. Each of these conditions presents with its set of symptoms, diagnostic criteria, and recommended treatments. However, what unifies them is the pervasive sense of excessive, prolonged worry or fear affecting the child's daily life and activities. Recognizing anxiety in children can be challenging, as some of the symptoms can easily be dismissed as typical childhood behavior. Parents often overlook signs such as excessive shyness, extreme clinginess, or frequent stomachaches before school. Other subtle signs include sleep disturbances, heightened irritability, and an obsessive need for reassurance. It's essential to understand that these behaviors, when persistent and disruptive, are not mere phases but possibly early indicators of an underlying anxiety disorder. Research from the Journal of Anxiety Stress Coping emphasizes the importance of parents recognizing these signs as potential markers for early intervention. A study indicates that early recognition of these subtle symptoms could drastically improve long-term outcomes, reducing the severity of the condition as the child grows into adulthood. The first step in effectively managing childhood anxiety is obtaining a comprehensive diagnosis from a qualified mental health professional. Cognitive behavioral therapy is considered a frontline treatment for childhood anxiety. CBT is backed by extensive research, including studies published in the Journal of Consulting and Clinical Psychology. CBT focuses on helping the child identify thought patterns that contribute to their anxiety and replace them with healthier, more constructive thoughts. In addition to CBT, medications such as selective serotonin reuptake inhibitors are often prescribed. A meta-analysis in the Journal of the American Academy of Child and Adolescent Psychiatry indicates that SSRIs are effective for treating childhood anxiety disorders, although medication should ideally be considered when other interventions have proven ineffective due to possible side effects. Parents can also employ several supportive strategies at home. Encouraging open communication, creating a safe emotional environment, and practicing relaxation techniques like deep breathing exercises can significantly aid in managing symptoms. Early intervention is not merely a clinical recommendation but an imperative. Research published in the Journal of Developmental and Behavioral Pediatrics shows that early intervention drastically reduces the risk of a child developing other mental health disorders in adolescence and adulthood. The sooner we identify and address these signs, the better the quality of life these children can have in the long term. Before we conclude, a quick word from our sponsor. This video is brought to you by Embracing Euthymia, a guide to cultivating mind wellness for patients, caregivers, and providers. This invaluable resource is now available on Amazon bookstores. Click the link in the description below to get your copy today. And as we conclude this video, it is my earnest hope that healthcare providers and parents alike will live with a multi-layered, clinically informed understanding of childhood anxiety disorders. By recognizing the early signs and adopting evidence-based interventions, we can mitigate the debilitating impact of anxiety on our children, offering them a brighter, more stable future. Thank you for your time, and please feel free to engage with questions and discussions as we continue to break down the stigma surrounding mental health issues, especially in children.